Welcome to Straight Talk with My OBMD podcast. Join me for a bi-weekly discussion on topics most relevant to women's health today. We are your source for medically accurate, real-world advice and all things related to your health and well-being as a woman. From menses to menopause, we've got you covered. I'm your host, Dr. Dana Smith, a fully practicing, board-certified OBGYN physician with close to 20 years experience. I am also the founder of the website that is 100% dedicated to women's health, myobmd.org. At myobmd.org, we write on all aspects related to women's health. Listen to our podcast, visit our website, subscribe to our newsletter, and follow us on Facebook and Instagram, myobmd.org. And if you are diagnosed with, for instance, let's start with the postpartum blues, what are some of the treatment options for the patient at that time?
Sure. I just want to add, by the way, that patients can absolutely reach out to us directly.
Oh.
They don't require a referral. They don't have to come from, another doctor or another practice or anything. They can go on our website and they can schedule a consultation with one of our coordinators and, usually very quickly. So I would absolutely encourage that.
Thank you for sharing that. I did not know that.
I'm happy to.
Yeah, that's awesome.
So I think it's clear that, again, we want to differentiate something from the baby blues from something more severe, more serious like postpartum depression. So as I mentioned, it's important to take a look at the degree or severity of the symptoms and the timing. And we have screening tests available where we can check that. And if someone does screen positive for, let's say, postpartum depression, there are a number of different treatments that have been shown to be quite effective and to work well. For example, therapy, psychotherapy, using a variety of different modalities, including, say, cognitive behavioral therapy is a very important and very popular one. So patients who want to approach it from that standpoint can utilize therapy. That's been shown to work. Individual therapy works. That's just like one-on-one, you and a therapist. I think group therapy is particularly powerful in the postpartum phase and even before that. I think so many people on their motherhood journeys who are feeling the stress and the strain of mental health challenges, they can feel so isolated. And I think there's something so powerful about the energy of the group, about being with the group, about having that type of support from people who are going through similar things and similar situations. So if I could just throw in a plug for group therapy there, but this is one of those things, all of the above, whatever works for you. And for people who don't really feel that they want to go through therapy process, there are absolutely medications that can be utilized that have been shown to be quite effective for managing postpartum depression, for example. Medication isn't right for everyone, but there are some people who it's, absolutely the best choice. And so at Seven Starling, we offer all of those different treatment options, group therapy, individual therapy, as well as medication management. As to whether people may find a synergy doing group therapy and individual, or group therapy, individual, and medication, all of the above, or you're free to pick and choose as to what works best for you and what makes sense to you at your particular life stage.
That's awesome that that you have mentioned, you've observed that with the group therapy. I think that that's fantastic. Is that something that you can do through Seven Starling? Do they have group teletherapy?
Yes, we do. Oh, 100%. It's something it's one of the things we are most proud of, because I will tell you though that people can be resistant to group therapy at first. I don't want to, concerned about talking,
Privacy.
telling my story in front of other people. But once you have seen the power that unlocks, I think that it's tremendous. And we are just thrilled and really honored to be able to offer this to people because I think it is such an important tool for healing.
Awesome. That is fantastic. So, for the medication therapy, would you say that there medication therapy that can be offered that is consistent with breastfeeding?
Absolutely. That is something that all of the psychiatric providers on our platform are trained and familiar with.
Hmm.
And fortunately, there are a number of medications that can be utilized with breastfeeding.
Awesome. Awesome. And then one of the and of course, just like with everything else, there is lifestyle opportunity for as part of the treatment, such as um prioritizing rest, uh, making sure you're eating foods that have high nutrient density so that you are getting your proper nutrients. I always tell patients continue your prenatal vitamins after you've given birth, so that especially for the breastfeeding mom, your caloric intake increases. Your, excuse me, your caloric intake should increase in order to meet your metabolic demands. And so you want to make sure you're eating foods that are nutrient dense. It's okay to take a break and allow your spouse, family members to care for the baby. You do not
Yeah.
have to be riddled with guilt because you are choosing to sleep when you have been given that opportunity to sleep. So, some of these things can really also go a long way in the treatment of some of the symptoms that you may be experiencing. So we always want to address the lifestyle factors that goes into play with some of what you may be experiencing. And was there something that you wanted to add, Dr. Roskin?
Yes, thank you for mentioning that because I do think it's so important. All these things, again, are additive. And I think
Mhm.
this role of support from your partner, from your family, from your friends is critical. And it's one thing to say, oh, take this medication or do this thing. But I think there is, again, a lot of power in, being kind to yourself and
Mhm.
not being burdened with the guilt. You have to take the time to allow yourself to recover and to allow yourself to adjust to your new
Mhm.
situation and your new role. Um, it's so hard for new moms, new parents to find the time
Mhm.
and we're talking about like these basic things, sleeping and eating. And we're telling people, and we have to sit here and say, hey, it's okay to do these things. These things are essential to life. And, you deserve to be able to do these things. So I'm just really happy to see that, again, we're starting to focus in on
Mhm.
that people should not feel guilty about this. One of
Mhm.
the things I'm also really excited that we do at Seven Sterling, I did mention that we're a digital platform. And so we provide services via telehealth. So it's not like you have to take a half
Mhm.
day to
Mhm.
get in your car, go to an office, wait in a waiting room. No, we can take care of this for you while you're at home, whether it's the
Mhm.
individual, whether it's the group therapy. And so I think that's also been really essential in us getting care, to the people that need it when they need it.
I think that that is just so fantastic. And I've just been spreading the word on Seven Starling since I have discovered it because I just feel so passionately that this has long been overdue
Thank you
that
so
we need
much.
this service. And
Thank you.
and then the most severe form of our mental health challenges that a patient may experience after giving birth is postpartum psychosis. Thankfully, that is a rare event, um, but it does happen. It does happen. And tell us a little bit more about postpartum psychosis.
Yes, well, it is rare, but it is quite severe and it can be a quite dangerous condition. Usually, when we're talking about psychosis, we're talking about a certain degree of detachment from reality. A person
Mm.
may be delusional, hearing voices, sort of in an altered state of reality. And this is quite a serious condition. In many cases, hospitalization might be required. So I usually think that it should be treated as in the way we would treat a medical emergency.
Mm-hmm.
Um, People can have racing thoughts, what's called disordered speech,
Mm-hmm.
switching topics mid-sentence. They can be disoriented. Um, and tragically, it can result in violent behavior. There is an increased risk of both suicide and even infanticide. So I think when people are exhibiting these symptoms,
Mm-hmm.
they often should be brought right to the hospital. There are
Mm-hmm.
ways to, again, to diagnose this. There are ways to manage it.
Mm-hmm.
The worst thing to do is to ignore it. It is absolutely 100% something that shouldn't be ignored.
Mm-hmm.
And when you think about the way we manage other conditions, if someone had uh, severely high blood pressure, if someone had an eclamptic seizure, we don't say, oh, well, maybe, let's see what we're going to do about it. This also is a severe condition and it needs to be managed urgently. And
Mm-hmm.
thankfully, with proper early diagnosis and treatment, this also can be treated successfully. And
Mm-hmm.
so I think the key is to um, evaluate and act.
Mm-hmm. And so this is the one condition where you would really need the partner to recognize this and the partner to be, or the support person, the family members to be the ones to recognize this and take action. Is this something that you would less likely expect the person who's experienced it to have that insight to know that they're experiencing this?
Well, I think some people can have the insight, but remember, part of the illness process is to lack insight, right?
Mhm.
So sometimes it's one thing people don't often think, oh, I'm having a delusion. That may be a tall order to assume
Mhm.
that someone can diagnose themselves. Now, if they can, fantastic. They recognize it, they go right to the hospital and get treatment. But I do think it's something that everybody's support person should also be aware of and be aware of how serious this
Mhm.
condition can be.
And then, as the person who was the support person, can you speak to that person why taking action in this situation, even removing the baby, is an act of love as opposed to maybe an act of betrayal? They may be conflicted about this.
Oh, I think it can be heartbreaking because I think often the person experiencing this condition, again, there are things they understand and then things that they don't have an awareness of. So maybe they're aware that, for right now, maybe they can't be with the baby, but they will be with the baby soon. And so, yes, it can be very difficult and very stressful. But there are some cases, and fortunately, again, they're quite rare, but there are some cases where the baby might be at risk, where
Mhm.
people in the household might be at risk. And
Mhm.
so that is what takes precedence is getting this person into care, getting them treated, and getting them well.
Absolutely. And certainly it's something that would be emotionally, the caregiver may feel emotionally anguished about doing. However, just to reiterate that it is an absolute 100% act of love to get them the help that they need and not an act of in it's nothing more than or nothing more, nothing less than an act of love, because it is, you are sending someone, um you are giving them a lifeline when before, as they have now become quite maybe lost in some sense. So just want to kind of reiterate that for the person who, the caregiver, that this is something that they are doing, it that needs to be done, and that the person that is experiencing it will appreciate this immensely once they have been treated and have and are then on the other side of their recovery.
Dr. Smith, you said it perfectly. It's an act of love and it's a lifeline. And
Mhm.
so those are the things to keep hold of when going through a nearly intolerable situation like this.
Right. And like if it may be hard for someone to recognize some of the symptoms, and it may be even easy to dismiss some of the things as like, oh my gosh, I think they're just so tired. But if you find that that person is consistently like maybe talking about things that just doesn't make any sense, or they're just referring to things that they're referring to people that are not there, or and this is not just a one-off, then please take it seriously, and please go get the help that that is needed. So want to just kind of follow through with that. Now, we have talked about postpartum blues and postpartum depression and postpartum psychosis. What are some of the risk factors for the person who may be experiencing this? Are there people who are more vulnerable than others? Is it a certain group that you see this more often in and not others?
Well, there are a number of different risk factors for any of the perinatal mental health conditions. I think people with a history of mental illness,
Mhm,
that's, always a risk factor. And that's true of many other conditions,
mhm,
not just mental health conditions. There can be stressors, for example, people with some socioeconomic challenges. Uh,
mhm,
but really, all people from all walks of life can be vulnerable to
mhm,
this. Um, People with a history of substance use, may tend to self-medicate. Now, that may be a sign of other symptoms that were going on prior. But remember, this is something that's very common. Some studies show up to 1 in 5 women can be
mhm,
affected by perinatal mood or anxiety disorder.
mhm,
Um, so it is something that happens a lot.
mhm,
And I think it's important if you have risk factors to be on the lookout. But remember, it's so common that it's something we screen everybody for.
mhm,
Because I would tell you, think the majority of the time, I see cases in people who didn't have a pre-existing risk factor.
mhm,
And, again, the tragic thing is, despite being so common, well over 80% of people don't get treatment for these
mhm.
conditions. And again, we can
How
screen for them,
sad.
prevent them, we could treat them with
Mhm,
medicine, without medicine, whatever you like. And so
mhm,
the key is to be educated about this,
mhm.
to be screened and to get the care that people need.
Absolutely. And one of the things like and sometimes I point this out to the nurses that a lot of people don't recognize as a symptoms of a mental health challenge is irritability, So sometimes you have that someone that's just very irritable or just easily irritated, that actually can also be a sign that there is something going on, and not just, oh my god, she's moody. It's easy for us to react to that, right, and say, oh my god, I don't want to be around her, she's just so moody right now, or she's just, but the ease of irritability, especially if it's out of character for that person, it's really, it can also be a sign that there's something more going on.
Yeah, that's really true. And I think, a lot of times these things can happen gradually. Now, sometimes it can happen fairly acutely, and sometimes you see the warning signs, but sometimes I think people in the household may become a little bit acclimated to, oh,
Mm,
she's just this way. And it's important to not be that way, to always, be on the alert because, like I said, recognition is key to treatment.
mhm. Absolutely, absolutely. And so what is the prognosis for the person who has experienced this?
The prognosis is excellent. Now, obviously, it depends on the diagnosis, depends on the severity of the condition, as well as the level of support. But when treatment is started right away, for example, at Seven Starling, we see over 90% of our patients feel better after
Mhm,
treatment. And so treatment is quite successful. I think it's key to have knowledge about what you're going through, to have support both in the moment and going forwards. And
mhm,
then people will be well and people can adapt and, be healed and be their best selves. Um,
mhm,
so I think that's one of the things that's really gratifying about working in this field. There's so
mhm,
much we can do. The frustrating part is getting people into care, getting people diagnosed and into care. But once they're in care, people do quite well.
Mm-hmm. And then for the next pregnancy, would you recommend actually doing anything preemptively? Would you recommend therapy even before you have any signs of any challenges?
I like to advise my patients, if anything, almost like a refresher, a brush
Mhm.
up. Maybe it's just, working on some mindfulness techniques, maybe some cognitive behavioral trainings. I think that can be effective because remember, we did discuss before risk factors. And if you've had this particular condition with a previous pregnancy, now it doesn't mean that 100% you're going to have it again, but it is something I'd look out for. And it's
Mhm.
something that you can, get ready for and be ready for and
Mhm.
prevent just
Mhm.
through those steps. So
Mhm.
I do definitely make my patients aware of that.
Okay, very good. Awesome. So thank you so much for your time and for being a guest on the Straight Talk with My OBMD podcast and for your discussion of this really, really important topic of mental health and mental well-being during the motherhood journey. Thank you again, Dr. Amy Roskin, and please let us know again about Seven Starling and where we can find where we'd be able to find you.
First of all, it was my pleasure. Thank you so much, Dr. Smith, for drawing attention to this area because that
Mhm.
is what we need. And for Seven Starling, you can find us at www.sevenStarling.com.
Awesome. Very good. And of course, for this topic and many others, you can visit the website myobmd.org. We have plenty of material on mental health, well-being, mindfulness, and anything that you do not see and you would like to see, just message me, reach out to me on Instagram. It is our pleasure to have had Dr. Amy Roskin with us today to discuss the topic of mental health well-being in the motherhood journey. Thank you again, Dr. Roskin.
Thank you.
Thank you for listening to another episode of Straight Talk with My OBMD podcast. To learn more about this topic, visit our website at myobmd.org. Subscribe to our newsletter, follow us on Facebook and Instagram. I can't wait to spend more time with you on our next episode of Straight Talk with My OBMD.